I now recognize the gentleman from Texas for the purpose of his opening statement.
Thank you, Mr. Chairman. This is truly a partnership. I may be leading it with the majority, with a Republican majority in the House, but Terry Sewell led it when the Democrats had majority, and I'm so grateful for our friendship and partnership. Again, Mr. Chairman, Ranking Member, thanks for holding this important markup today and for including this very important early stage diagnostic innovation. This legislation is named in honor of Nancy Gardner Sewell, as you mentioned, the mother of our colleague and friend, Congresswoman Terry Sewell of Alabama's 7th Congressional District. Ms. Nancy Sewell was an educator, civic leader, champion for children, advocating for childhood literacy, encouraging youth participation in local government, and cherishing the impact that the next generation of Americans would have on our great country. Ms. Nancy Gardner Sewell's greatest contribution, I think we would all agree on this committee, is that lady over there, raising a fine lady and fearless leader for our wonderful country, Ms. Terry Sewell. Nancy passed away at 81 after a courageous battle with pancreatic cancer, but her legacy will live on not only in her daughter, but now in this piece of legislation and these innovations that will no doubt save millions of lives. Rep. Sewell has been, again, a great partner, and we've had a lot of help, hadn't we, Terry, from folks out here that have joined us today from a number of organizations, grassroots cancer advocacy groups, American Cancer Society, Association of Community Cancer Centers, Cancer Support Community, National Grange, Go To Lung Cancer, National Minority Quality Forum, Action Network, Ovarian Cancer Research Prevention Cancer Foundation. How about y'all just raise your hands so we can give y'all a round of applause for your support. Terry, I lost my granddad and grandmother on my mother's side to cancer. My dad is a cancer survivor, and so I think probably nobody is untouched by this insidious disease one way or the other. Let me run through just some stats because I think you'll find them not only interesting but compelling with the context of this new innovation on diagnosis. Approximately 1 million Medicare beneficiaries, 1 million Medicare beneficiaries will be diagnosed with cancer this year, costing $1 trillion over the 10-year budget window. Of those million, 1,200 Medicare beneficiaries are diagnosed with early stage cancer. And we know that the late stage cancer costs 75 cents on every dollar. We also know that 70% of cancer deaths occur where patients did not have access to screening. And research shows that early detection results in 4 times better outcomes and 7 times lower cost. This H.R. 2407 is a triple threat for access, for outcomes, and to bend the spending curve. The legislation gives CMS the authority specifically to cover multi-cancer early detection tests once they are approved by the FDA, ensuring our nation's seniors have access to the groundbreaking innovation that will transform the way we treat, diagnose, and prevent the progression of cancer. Like I said, if we're going to win the war on cancer and defeat this common enemy of ours in this room, we have to unleash the power of innovation. That's what this legislation does. Again, Terry, thank you for being a good friend. Thank you for being the leader on this and allowing me to lead it as we have the majority. And what an honor to have your mother's name on H.R. 2407 and for her to have a legacy of millions of Americans whose lives will be changed for the positive as a result. I encourage all my colleagues to support H.R. 2407. And Mr. Chairman, again, thank you for your leadership. Ranking Member, thank you for allowing us to come together in a bipartisan fashion to do some really good work.